Port catheter insertions. Introduction. Vital port and portacath are devices placed in a big vein that allow doctors, nurses, and healthcare providers easy access to a patient's bloodstream repeatedly and safely. In this tutorial, these devices will be referred to as ports. A port is a long, thin, hollow tube that's inserted into a vein of the neck or chest. It is long enough to reach the large vein that enters the heart. Ports are used when a patient needs intravenous treatment for a long time. Your doctor may have recommended that you have a port surgically implanted. The decision to have this procedure is also yours. This patient education tutorial explains the benefits and risks of ports. It also discusses how to take care of them. Port. IV stands for intravenous. Intravenous means into the veins. IV therapy is treatment that is delivered directly into the veins. This allows medications, fluids, and nutrients to circulate immediately in the blood. A port has two parts. 1. A chamber. 2. A hollow tube or catheter. The chamber is placed under the skin. The catheter is threaded into either the IJ or the subclavian vein all the way to the superior vena cava, the large vein that enters the heart. A port may have more than one chamber. Like other IVs, it is used to administer or give medications, fluids, and nutrients. It can also be used to draw blood. A port has several advantages over other IVs. Ports last much longer than regular IVs. A port can last a few years. A port rarely gets infected, blocked, or quits working, whereas a regular IV sometimes does. A port is usually surgically placed in the hospital or an outpatient surgical clinic setting. Procedure. A port is usually inserted in an operating room setting. A port can be inserted under local anesthesia, sedation, or general anesthesia. The choice of anesthetic depends on the doctor's preference and the patient's condition. Using a special needle, the doctor threads the catheter into either the IJ or the subclavian vein. This is usually done with X-ray guidance to make sure that the tip of the catheter reaches the superior vena cava. Once the doctor is satisfied with the position of the catheter, she or he connects it to the reservoir. The reservoir is placed under the skin through a small incision. The reservoir looks like a bump under the skin. This helps the healthcare providers find it when they want to access it. After the procedure, the patient is taken to a recovery room to wait for the anesthetic to wear off. Most patients go home the same day unless they need to stay in the hospital for other medical reasons. A chest X-ray may be taken after the procedure to make sure the catheter tip is in the right place and to also make sure that the lungs were not injured during the procedure. You may feel some tenderness after the procedure. This usually goes away in 24 to 48 hours. When a healthcare provider wants to withdraw blood or give a medication intravenously, she or he will just clean the skin over a reservoir and insert a needle in it. The patient may feel a small needle prick, but this is not really painful. It is much easier on the patient than trying to find a vein in an arm or a leg and then inserting a needle or catheter. A port has to be flushed with a special solution every few weeks to make sure it stays open. Risks and complications.